Welcome to the Aesthetics Unfiltered podcast. We are Michelle Jones and Melanie Torres, two leading medical aesthetic nurse practitioners and great friends based in California. We uncover the inner workings of the booming aesthetics industry from both the patients as well as the providers' perspectives.
Join us for the authentic conversations about current and trending treatments, best practices, and the real issues people face with modern beauty standards. Any information or advice given is general in nature. You should consult with a healthcare provider before undergoing any treatment.
Hey guys, we're in person with Aesthetics Unfiltered. It's a fun day, so this is our last two episodes. And I'm Michelle Jones, your host, and I have Melanie Torres, who you guys have been following along. And we are Aesthetics Unfiltered, and we're talking everything in the aesthetics industry, from patients to injectors. And yeah, so I think the first thing is what have you done to your face in the last month?
Right. I know. What's new?
What's new in your
What's new
face?
this week? Well, we're in San Francisco right now.
Yeah.
At Michelle's house, and we're super excited because we're doing our first in-person episode. I think it's going to go really naturally, and we're just going to talk about treatments we've done together. She actually treated me yesterday. I did a lot of work on my face, so I'm a little bit swollen, but overall, I think I look really natural. This is the first time she's injected me in over 2 years. So we did Sculptra to help the peripheral part of my face, because as you age, you lose the volume here around the edges of your face and everything starts sinking in. So we did Sculptra around in my preauricular. I'm a little bruised here, and we did some in my temples. My temples were really hollow, and then we did some really light skin weave in my neck to help all the necklace lines. And I'm getting laxity because I'm in my late 40s. So we did a great treatment. I'm super happy with it. Am I swollen today?
You're a little bit swollen, but not bad. Okay, yeah, so I know what you did in your face because I did it.
Yeah.
Yeah, I think this is a good thing just for patients and to see is you're a little bit swollen the next day, but it's not too bad. Yeah, I think that will lead us into the trends of this year, which is really Sculpture and Skin Vive has really saved my practice. So thank goodness, because everyone wants really natural things. I'm also puffy because I'm aging and I'm doing everything in my face because I have a lot of anxiety. So I also did Skin Vive 2 days ago.
Okay.
And then I did a little bit of filler in my mid cheek up to my tear trough, trying to correct my tear trough.
You always are trying to do that.
I probably shouldn't have. And that's a whole nother issue. But anyways, we're both swollen and the weather is changing in San Francisco. It's hot, now it's cold, so our allergies are crazy. But anyhow, it's always fun to know what you've done in your face this last. Oh, and I did Dysport. And the first time, actually, I haven't done Dysport in the upper platysmal bands, on the jawline, the Nefertiti lift. And that was kind of cool because I've been doing that a lot of my patients. It's the most requested tox treatment this year has been jawline tox, not like masseter, but the actual platysmal bands, the top of the platysmal bands. These are the bands that pull everything down. And so I just did a little bit on the medial jawline and I actually feel a lot tighter. It's kind of crazy.
It helps pre-jowls, when you're getting the little side. It just helps
tighter.
It helps snatch your jawline, but just with a little bit of neuromodulator, Botox, Dysport, Jeuveau, whatever.
Exactly.
I love it too. And she did a little bit of Sculpture, right? On my jaw, just a very small amount, where my angle is of my jawline. Just
you feel tighter.
I feel great. Yeah, I feel great. The swelling will go down over the next couple of weeks with Sculptra, and then it looks like you go back to your baseline. And a lot of patients are like, "Wait, I loved myself first when I first did it, but now it's all gone." And then people get scared that Sculptra isn't effective because you go back to looking
back to
you
baseline.
did, right? And then it takes to me, it takes 2 or 3 months to really see the results.
Yeah.
So people that are new to aesthetics get worried, but it's going to all naturally build back your collagen.
I agree. Yeah, that's a good topic. Those are some of the questions we get. So that's what we did in our face. There's always trends going on that we'll get to at the end of the episode, but it's always fun to discuss just for a little intro. One of our topics today is really cheek injection fillers. This might be, it's a little bit for our audience that are patients and a little bit for our audience that are injectors. It's a little bit of both. So we'll go into that. As I've been training in the industry, there's a lot of confusion now over just simple injections that we been doing for decades and years. By the way, you guys, I have 2 new cats after my cat Whisker passed away a few months ago. I have 2 new Persian cats and they're babies and they're very vocal, so you might get to see them on this podcast. And if you follow along on my Instagram, you'll definitely see them. But sorry for the meowing. Actually, I'm not sorry.
They're so cute.
I'm obsessed with my cats, so
they
love
have to deal with it. I want them to come up and jump up.
I know, I do too. If not, we'll get them up here. Sorry, a part of my life is these cats. It's like my whole aesthetic feed is Instagram is like cats and aesthetics. So that's where we're at.
So wait, going back to the cheek
filler.
Yeah. What have you heard about that?
I think since the introduction of ultrasound, we've had a little bit more insight as to where that filler is placed over time. And so for those of you that maybe don't know what I'm talking about with ultrasound is basically just like you would ultrasound. It's the same machine that you would for
when you're
any other medical procedure, but we can really use it now to see placement of filler, and it's kind of a cool tool. There's a lot of different uses for it, but what I've been noticing in my practice is we're in this correction phase of aesthetics where there's a lot of controversy online with fillers, and a lot of that I think is not completely truthful. It's just people wanting attention and kind of dramatizing everything, and it's making the public really confused. So we're having to educate patients a lot more, but we're also in this trend of everyone wants to look very natural. Thank God. We don't want to look done anymore. So, and we're also as injectors a little bit more savvy at really assessing people's faces, and I'm correcting faces now. But what some of the things I've been seeing in the practices and some of the kind of complaints that patients are talking about, and it's typically not to toot my own horn, but it's not really my work over time. It's I'm getting,
new patients.
Yeah. And I'm seeing that like when they're smiling, they're like, hey, my smile is not as full as it used to be. Like I feel like when I look in photos, I can't really animate. My mouth is not as wide, like something's going on where I look too cheeky and I can't really visibly smile as hard as I could.
Like their apples of their cheeks look different? Okay.
Well, I just feel like their smile's restricted. And so I've been taking my ultrasound and just looking under their cheek, and some of what I've been seeing is just that I'm seeing the filler in the actual muscle, which makes sense. But if it's overfilled over time, and usually these patients are people that look visibly overfilled. So even if you don't have an ultrasound, you can see it, but just visually without the ultrasound. But even just doing a little bit of dissolver, which is called Hylenex, where I'm seeing that filler in the smaz layer, which is like the fibrous layer that overlays like the muscle, it just loosens up the activity and it looks, dissolves a tiny bit of that filler that should be really on the bone or in the skin. And when it gets stuck in that muscle, it kind of decreases the animation a little bit. And this is not for everyone. I even have a little bit of that in my cheek, and it's kind of inherent if we've been injecting a long time and we've had filler. But yeah, I gotta look up. But what I'm seeing is just dissolving a little bit. It's helpful to loosen up that filler that might be stuck too much in the muscle layer. And I'm getting a little technical. So that's been kind of a trend, and that brings a question for like injectors of like, well, how do I inject cheek filler? Because I think people are getting a little confused now.
Because we're all educated, like when we first start to do 3 injection points on the bone, so group injections that define like the zygomatic arch. Right?
Yeah.
And so are now people saying that's not the correct. I mean, there are always injectors saying, "Oh, it's the wrong way. Oh, now it's the right way." And if medicine always evolves and technique always evolves, so I don't necessarily think what we've been doing in the past is wrong.
It's not.
So what are people saying? What's the new versus old?
What I'm hearing is one thing that's really like out, I would say, is back in, I would say like 10 years ago, we used to put a lot of product on the lateral zygomatic arch, like the lateral cheekbone extending all the way to the ear. Really, we wanted that really, because that's what the Kardashians were doing. They had those really prominent cheekbones that like extended all the way back to the ear, basically, that was kind of like symmetrical and didn't have a light of reflection. And now we're like
the angled kind of heart shaped
yeah
face that we're all
well, that's still in, but not as dramatic. Like back in the day, 10 years ago, it was like more dramatic. People wanted that look. But what we're finding and is that, and I follow some of my amazing mentors out there, Nicola, she has a study that's going on that basically says like the filler on the lateral zygomatic arch, if it's too far back, can actually float into the temple space. And it's like in the deep superficial temple fat pad. It's like the lower fat pad of the temple that it's synonymous with, and it kind of slides into that space, which in my case, because my temples are naturally hollow, I'd be happy because like I need more filler in there. But I actually
yeah,
did
right.
just
Like, what's wrong with that? No offense, but like, is that bad or is it
I
just
just
an
think
observation?
I think it's an observation. It's also just wasted product.
Okay.
I think it's just like not an efficient use of the product, you know, if and we're just learning that it can go into that space. And also I think aesthetically it looks strange when it's all the way back. But
I feel like it's when it's too much in the medial cheek. To me, like what you're talking about,
yeah,
scrunches. To me, that's
looks strange too.
way more ineffective. I just think it's about doing the right amount of product,
Exactly,
and not keep doing your lateral zygoma every 6 months or you're like
yeah.
Like yesterday with you. You just did a really tiny bit
I
in my
barely
area
put any.
just to
Yeah.
help like smooth
The
my
skin
skin
texture.
there and make it just look more cohesive. But you know, with me, I think the old original technique is amazing, and it's more about the artistry and just not
Over treating.
yeah, and also not just doing not
Yeah.
just doing the 3 points
Yeah.
that we're taught in 101, but doing a little bit where
Yeah.
you're saying as well.
I think just using your artistic like eye. And I think, you know, as this industry is evolving with new injectors, there are some philosophies of injection technique that it's like very mechanical and like what's the word for that? It's not artistic. It's kind of just like and
Like
I
the
won't
standard.
I won't say yeah, I won't say what, but it's like there's different methods. I think that maybe injectors that don't have an artistic eye are just taught to go in certain points
Right.
just without looking visually.
Yes.
And so I think as advanced injectors, understanding the anatomy, the ligament, what you're trying to create, and just like, you know, making sure things look balanced. But I
100%.
think the other big issue with the cheek is doing a lot of, so you can use a needle or a cannula with cheek filler. And really, your product should only be placed periosteal on the bone or subcutaneous, like superficial. And when we get our product a lot into like that middle layer, which is like the muscle layer, the smaz layer, that's where things can get a little bit wonky, like over time, if you just keep replicating that. And that's a very like strategic advanced technique where we have to be really specific as trainers and injectors to make sure with our cannula that we're not in the muscle layer. And so that's what I've been teaching really with my classes is like if you're using a cannula, which I do like in the mid face because it's a little bit, I feel like it's a nice transition zone. I still use needle, but you have to make sure you're really deep with that cannula. And before we were taught, oh, it should be comfortable for the patient. It might not be comfortable if you're sliding against that bone. It might be a little scratchy, and that might actually signify you're in the right space because a lot of us are in the wrong space when we're injecting. And I hate to say that. So there needs to be more education on that. So I think we're just with ultrasound, it's like highlighting, hey, our product might not be perfectly placed. And that's okay. I mean, 99% of the time it doesn't create a complication, and I have product that's in my muscle and it's not a big deal. But like if you're over treated, overfilled, that's where it becomes an issue. And that's why you need to trust your injector and just have someone that you can have an honest conversation with. And that's like our whole ethics thing that we went into is like I have no problem like making no money now and just telling people they need to be dissolved because I have like a stream of consciousness. Like I know in the long run it will be better for the patient and they'll trust me and we'll do other things together. So yeah, that's like a big, you know, the
New
cheap
education.
yeah,
New
I'm
option.
just
I think it's good to like teach both. But
Yeah.
that, like you said, is doing the safety measure and putting it in the right plane.
Yeah.
And I think, like you said too, I think cannula gives a really natural result in the cheek because you can fan it laterally, like we were saying, as well as turning it in medially. And it just, you know, some people say, oh, you lose product that way because it's more blended, but sometimes that to me looks better in my opinion. Some people are like, oh, it's not subtle, it's not, you know, significant enough when I look at it, but to me I think subtle
Everybody
results
wants subtle now.
Yeah, exactly.
Yeah, I want subtle too. We just want to like preserve, but yeah, I think it's hard to teach new injectors the proper cannula technique, and that needs to be a course by itself of just like here's how to like
a lot of people don't know.
Yeah, and like some cannulas are better than others. Like we're like the more expensive ones are easier to use in my opinion.
They are. They're really pricey. I think a lot of spots.
Yeah.
They're like $5
I know.
a cannula or something, and so I think people that have smaller practices or aren't, you know, aware of them, it's a pricier addition.
Yeah.
But I don't know.
I'm like getting all technical and thinking about other techniques. I might go into it just even if we're off topic. This is more like I know this might be too advanced for like patients or people that are just like, I don't know what the hell she's talking about, but for injectors, I think there's like a whole trend of like bending needles, bending cannulas to like get the proper angle. Like in the lip, we kind of bend the needle, but like there have been reports of like the needle like actually popping, breaking in the skin, people. And okay, I want to know to the injectors out there, how are you actually bending a needle sterilely? Please tell me. Like
so not even the cannula, a real needle.
Yeah.
I've never done that. I don't know.
I've never, thank God. Yeah, I don't do that. But
I don't know.
I want to know like, do you really get better results bending your needle? B, like, how do you make it sterile without touching the needle and bending it sterilely? That like sounds like
I think when I've done it with cannula very rarely, it's like once it's under the tissue,
you can bend it.
Bend it slightly.
But that's scary. That's how it can.
But not needle.
Not to scare you patients out there. We're just going technical over here.
But isn't that how everyone does it? Is they kind of like angle it up?
Yeah, I think with a cannula it's easier. I think with a needle you have to, that would kind of like not be my best move.
Well, maybe next season we can have a talk whether you learned or tried it or no.
Yeah, we can get back to you on that. Anyways, yes, technique. We are now getting really focused on like technique and like going back to basics a little bit because we have more tools. But yeah, I think with cheek filler, we have to go back to the basics in terms of like, are we on bone? Are we superficial? And, you know, just making sure everything looks balanced. So that's my big speech on that.
Let's talk about ultrasound a little bit.
Okay.
Because yesterday we did some good video on it, and it was the first time she taught me about ultrasound. It's the first time I've used ultrasound on the face, and that's really like trendy now, and people are doing it for safety to make sure you're not near a vessel, so you don't puncture the vessel. And so teach me kind of like talk to us about your experience with ultrasound, what you like and dislike about it, etc.
Yeah. I mean, I've taken a few ultrasound courses and I'm not an expert yet, but I would say I'm getting more savvy and more advanced. And I really just use it if I'm doing like an on bone bolus of product in a higher risk area. So the two areas that I always pre-scan before injecting is deep temple and deep like nasolabial piriform space, just because there are variations in the anatomy and you know, you could theoretically have your deep temporal artery right on the bone where we want to inject. You could have your angular artery on the bone, and everyone's different. So it's nice just as a little reassurance tool just to see exactly where the artery is. And now the ultrasound devices, like the smaller ones, the Clarius, are pretty affordable for injectors. And it's, yes, I know it's hard to teach and it's a learning tool, but like anyone can see a pulsing artery on the bone and it's not rocket science. So like there's really no excuse, like in my opinion, to like not like even you've never seen ultrasound, you're like, oh, there's my artery on the bone. Like you like, oh, you're like that big black blob looks like filler. Like that's it doesn't have to be super complicated.
It's like a visual assistant.
Yeah.
And also, I bet it would be good if someone's concerned about something, whether someone had a bruise or there's like not as much cavity fill, you can use it as a tool to look to make sure things look safe under the skin. I think that's how I would utilize it with.
Yeah, so we did that on Melanie's Puriform face, like the nasolabial, before we injected product, and we could see that her artery was above her old filler. And so that gave me reassurance that it was not on the bone, and she was a good candidate to inject more filler into the space. I mean, there also is another theory that like some people might be a little too cavalier, like, and cause more complications with ultrasound if they're like, oh, like I'm super safe, so I'm just going to put a whole bunch in there. So there is that philosophy of like, oh, it can make things worse if like you're too confident with it and cocky. So I don't know. I think it is, if you're good at, it's a nice tool for certain things. But yeah, I think ultrasound's cool. I mean, now there's a lot of discussion online about temple filler as well. And, in my practice, I use either Sculptra or a hyaluronic acid filler on the temple. What have you been doing, Mel?
I usually use filler like the way that I use Sculptra too, but filler gives a quicker result.
Yeah.
And it's like if someone just has an event in a couple weeks.
Yeah.
Like, so I love doing temples the standard way, the Swift technique, the one up and one over, and just one injection point and slowly do a bolus. And then little tiny boluses. Yeah. A few of them, like you see it, and it kind of you blend in the filler down, and then you keep doing it until you get a correction. And then I also do, I don't believe it's on label yet, but I do the fanning technique. Superficially. Yeah, from down by the zygoma, I fan up for the lower temple, and you can like blend product, and like you just have to do it really slow. So and it's normal that it gets bumpy sometimes, but it does blend in if you use like a thinner product, and that's how I do temples. But
that's pretty much how I do it now. I mean, I've always, I think as you understand the anatomy, and you basically, if we're on bone, it's gonna backflow, and it's kind of a like in the muscle technique. Like it's the filler is gonna be in the muscle, but it doesn't matter because these muscles around here, like the temple and the masseter, aren't like contraction muscles. They're just skeletal muscles, so it won't cause a problem.
They're not mobilized.
They're not. Yeah, they're not gonna. You're not gonna see the product. But I think the main thing is, just because I have little ultrasound, I do like to scan here, and I do a smaller bolus at a time, because Lord forbid you're in a blood vessel. Like, if the less product you have in a bolus in that area, the better. And I do multiple little spots.
Is the on-label new way for a temple to do a deep?
It's deep like
temple, like all the way down through all the layers. Into the actual temple.
Yeah.
So that's the on.
The same.
So it's the same. So they're teaching both techniques to do the Swift as well as to go deep into temple.
Well, they're kind of the same. I mean, the Swift is like specific, one up, one over, but they're just saying the like upper region of the temple, like the anterior part of the temple, like to put most of the product and do it like a larger bolus up to 0.5 cc's. Yeah, and like up to 1.5 cc's per side is like what was on the study. Yeah. What? So I feel like
that's how much did you do for me yesterday? You did Sculptra. That's not on label. Yeah. That's not on label.
I did Sculptra, which takes a little bit. We'll go into the differences of why, but like I feel like putting that big amount of a bolus, I would probably only do that with an ultrasound first, of putting that much product in at one point with filler, just because I want to know exactly where I'm going on bone and make sure that there's not an artery there. But I also feel like the lower part fanning superficially, either in like there's 2 layers you can go into, with the right product, looks really good, and you use less product. So it's less painful for the patient in terms of like the pressure while you're healing. So that's like a whole debate online of like how people are doing temples right now.
There's debates everywhere, but like as long as you're safe and the patient looks good and you don't change their like natural anatomy, like I don't know. I like tried and true, like practice long-term results, but there's always new room for new studies and new findings, and it's cool that people are getting way more educated on the options now.
Yeah, and I mean, at least like we do have an FDA approval, which like was a big step, and like I know that takes like several years, and so that was the really like tried and true method like 5 6 years ago when the study started. But now we just a lot of like injectors have changed more to like superficial cannula technique in that time frame.
Yeah.
So I'm sure like that will be the next study for temple indication. Will
Right.
probably be so you can do both. But I think it is a little bit harder to teach the superficial technique because there's two different layers you can be in. And so I think for new injectors, that is technically harder to teach. And so I get it. It's kind of like it's
And
just
you can be with the fanning technique, you can be either in the super
Yeah.
like subdermal
Yep.
or down to
interfascial space.
interfascial
Layer
to be
four.
between
Yeah.
those two layers
Yes.
of the fascia.
Exactly.
I'm really okay. So you taught me literally the best thing I've learned in the last
Oh.
year in aesthetics.
What?
Because we all hear about the SMAS, and the
Yeah.
SMAS is like the way they do the deep plane lift, and I know SMAS is. I realize now SMAS is fascia.
It's fascia, yeah.
You taught me that, and now I'm like, now I get. I thought SMAS and fascia were two different things, and I know what fascia is. It's
Yeah.
like that thick layer that goes
Surrounds
over
the
the
muscle.
muscle,
Yeah.
right? It's like that little crunch
Yeah.
thing and everything. So
Yeah.
now I know that SMAS and fascia. And so thank you, Michelle, for
Oh.
teaching me. Now I know. I still don't know all the wording for SMAS, but I know now it's the covering,
Yeah.
and there's not two different fascias versus SMAS.
Yeah, I think just we're our anatomy as injectors just getting so like technical, like plastic surgery level, that the terminology is getting a little like interchanged, and we as injectors weren't taught like facial anatomy as like plastic surgeons, but now we're at that level of like education in our conferences, which is really good, but it's super advanced. And so we're just trying to sometimes we have to break it down and just make it like a little bit more simplified so that we can understand, because one word might have like four different words that different injectors are using synonymously. It's like festoon versus like malar mound. It's like there's slight differences, but like in our head, like this is very technical.
It's lots of information. It's like lifelong learning.
Like I could literally not work and just watch educational webinars all day, and like it's kind of fun.
It is,
but we're both nerds. That's why we love this kind of stuff. Like today, we basically just watched stuff and read articles this morning and drink coffee, and I think that's like not a lot of people I can do that with. So that's pretty cool.
I'm excited for the next episode because we're going to talk about like what we learned in the studies we read during coffee, and then like some trends online and everything.
Yeah.
So I'm excited for our final one.
Yeah. So we will wrap this one up. I think today we just wanted to go into kind of like a little bit more of ultrasound temple filler.
Now I'm looking down.
And what's that?
I know I was looking. I was looking at the time. It's perfect time. It's 30 minutes.
Yeah, I think it's a good. This is probably more of like a discussion for injectors out there of just like, what are your thoughts on what we talked about today? How are you doing cheek filler? How are you doing temple filler? And are you using ultrasound? And if not, like, what are your barriers to using ultrasound? I'd like to know all those questions.
Yeah, me too. Like what their thoughts are. My just final thought on this is the whole lateral like zygoma.
Yeah.
I'm just worried that newer injectors are going to hear that, and then they're going to put all the product in the medial cheek, and it's going to look even more cheeky. So I don't want. Like, I think the zygomatic like highlight I think is still great, but it's good to do like
I still do it. I just don't do like a lot, like the same amount back here. Like I kind of end at the tail of the lateral brow. So this would be like my most lateral injection point right here. And I wouldn't put like a whole bunch here because the bone, like my
so
bone
your
is,
lateral canthus is like your point where you do your last injection,
like a little, like a centimeter from the lateral canthus.
Okay.
So I'm still doing like a little. You need a little lateral cheek.
Right.
You just don't want it where the bone thins so much out
can't
here.
even find the bone.
Yeah, but it's also complicated because I know when injectors are using a cannula, they'll paint a lot of it, like a lot more of that product, kind of fanning above and below that bone, and like I don't know, like that's like a whole different discussion.
Whatever. Awesome.
So hopefully you're not more confused, but I would just say like, maybe revisit how you're injecting with your cannula. If you are injecting with a cannula, make sure you're deep and not just like, you shouldn't see the outline of the cannula if you're in the deep medial cheek fat. And I still like needle on bone I would say it's not like way back in the zygoma, but it's still lateral zygoma. I just like do little tiny bits and make it really artistic.
I like it when they do 2 layers.
Yeah.
They'll do like a poke and then they'll do a little poke like
Yeah.
below it and kind of do like a zigzag.
Exactly.
So it's not just one line. So it's a more
Exactly.
subtle, softer outcome.
Yeah. So I mean, I think in reality, it's just like, how can you? What's the least amount of product that you can put in someone's face and get the most, like, I guess, bang for your product in the face? So that's what I'm always trying to think about. We're not just trying to pump in product. We're trying to be really strategic how we place it, and we're really on like a natural. Everyone wants to look really natural right now, thank God. And I think we always did, but now it's like, at least we have like an idea of what natural actually looks like
And
now.
how people can look more natural.
Yeah.
There's like alternatives. Like
Exactly.
It's like art. So you can always change it a little bit and make it even more refined and more beautiful.
Exactly. I love it. And on that note, we will see you for our next episode. All right. Bye, guys. Follow along for our Instagrams. I'm skin.smarty.np on Instagram. And then we have
melanie.skin.mp.
Yep.
And then we're the aesthetics.unfiltered.podcast.
Yeah, exactly.
All right, guys.
Okay.
See you soon.
Bye. For our latest news, follow us on Instagram at aesthetics.unfiltered.podcast or in our personal pages on Instagram.
Mine is melanie.skin.np and Michelle skin.smarty.np, both on Instagram. Have a great day.